As we age, our health needs evolve from physical health to mental well-being. However, recent data shows that older adults who have good relationships with their primary care physicians, particularly those who practice in value-based care settings, may see a significant difference in navigating these changes in quality of life. In what way specifically? Well, Dr. Robert Zorowitz, an expert in geriatric medicine and regional vice president of health services for Humana, joins us with details. Good morning, doctor. How are you?
Good morning. I'm fine. How are you?
I'm doing good. I want to hear about this. So here we go. Can you start by explaining why primary care is so important for older adults?
Well, older adults experience changes in a variety of areas, not only physical health, but physical functioning, mental health, social context. And it's really important to have a primary care provider who can put this very complex jigsaw puzzle together and come up with a care plan that'll really provide longitudinal care over time rather than just coming in whenever you're not feeling well and keeping you healthy and really encouraging quality of life.
Now, what are some of the I can't even talk this morning, getting older, doctor. What are some of the specific benefits seniors can expect from regular primary care visits?
Well, with regular primary care visits with a primary care provider who knows you, you of course get those regular checkups. But I like to talk about check-ins, meaning how are you feeling? What's changed since the last time we were together? How are those medications working? Can we reduce them maybe? Can we adjust them to make sure that you're not having adverse effects? And can we talk about what kind of preventive screenings and maintenance is important to prevent diseases and disorders from occurring in the future and to keep you on your feet and to keep you healthy?
I like that idea. Now, what are some of the key screenings and services you recommend for patients, particularly for those who are 65 and over?
Well, as we get older, even for 65 and older, diet and exercise remains paramount. I would be remiss if I didn't mention that. Screenings include such things as vaccinations to prevent common communicable diseases, infectious diseases, screenings for common diseases like diabetes, hypertension, cardiovascular disease, and cancers, which are better treated early when discovered rather than waiting for them to become more troublesome. And also putting all of this together in a preventive plan, in a comprehensive plan that also includes mental health screening for things like depression, which becomes more common. And a primary care provider who knows you, knows what's important, and knows what matters most to you can really focus on what's necessary to maintain quality of life rather than just the length of life.
Now, let's talk about value-based care. How does it differ from traditional fee-for-service care, and why is it beneficial for older adults?
That is a great question. Well, fee-for-service care, fee-for-service Medicare generally is a matter of paying per service or per visit. And that often results in quicker visits, whereas value-based care is a game changer. Rather than paying for per service, it pays for quality of care and outcomes. So it really encourages longer visits, more time spent getting to know you, getting to know what is important to you, having more time for education, for training, and coming up with a comprehensive healthcare plan. It also allows for team-based care, meaning not only having a primary care doctor, but perhaps a nurse practitioner, a care manager, a dietitian, all coordinating care together to encourage quality over quantity, to encourage quality of life, rather than just that, incidental coming in for, once in a while to check the blood pressure or when you're feeling sick. And it really encourages that kind of trust and communication that's key to having that longitudinal relationship.
For those in our audience who don't have a primary care clinician or is interested in switching, how do they go about finding one?
Insurance carriers usually have a number on the back of the membership card, which allows the member to call and find a primary care provider that's both within network and close to where you live. Humana certainly has that, and insurance carriers will usually have a website with a search function in which you can put in your geographic area, the type of provider you're looking for. And as I said, Humana will also have that at humana.com. I would also say that it's important to find out whether your company, whether the insurance carrier, can refer you to a primary care provider that focuses on senior health, because obviously as we get older, we would like a primary care provider who understands the needs of older adults.
Doctor, I hope you can answer this question. As we get older, more women are more than likely to go ahead and see their clinician or their doctor. It's the men we got problems with. How do we get those guys in, man?
That is a great question and a not easy question. I think having a primary care provider who can spend time and have patience, I think will encourage more guys to go in and get care. And also having someone who will listen to what's important, because I think one of the big barriers in trying to maintain primary care is the feeling that someone's not listening to my particular needs. And I think being able to kind of bridge that gap and listen and spend time, I think will encourage more men to access primary care.
I'm gonna give you a fist bump for that one, okay, doctor?
Thank you. I'll take it.
Been speaking with Dr. Robert Zorowitz, an expert in geriatric medicine and Regional Vice President of Health Services for Humana. Thank you for joining us on Morning Blend.
It was my pleasure. Thank you.